Hello, today I'll be doing manual muscle testing of wrist flexion and extension. These two motions are measured in a seated position with the patient's forearm and wrist on a flat surface to eliminate any elbow or shoulder joint movement. For wrist flexion, there are two muscles that we're going to test for grades 5, 4, and 3. For measurements 2, 1, and 0, we will only be testing once. So to test for our one muscle, flexor carpi radialis, I'm going to first put my patient in available range of motion for wrist flexion. I'm going to stabilize with my right hand on the ulnar side. Ask my patient to go to available range of motion. I'm going to apply pressure with 2 fingers at the base of the first and second metatarsal. I'm going to apply the pressure towards me in an extension position, asking my patient to bring their hand and fingers towards their chest or their face and hold against my resistance. And hold it, hold it, hold it. Great job. That was a grade 5. For grade 4, I would have my patient in the same position applying pressure. The patient is able to hold the motion and then break. For 3, once I apply pressure, the patient will break immediately. Before we go on to 2, 1, and 0, let's test the other side, flexor carpi ulnaris. So I will be stabilizing with my left hand on the radial side, using my right hand to grasp the base of the 4th and 5th metatarsals, applying an extensor resistance force, asking my patient to bring their hand towards their face and chest. And let's test. Hold it, hold it, hold it, and release. So that would be a grade 5 for flexor carpi ulnaris. A grade 4 would be applying pressure again on that side. The patient is able to hold it but breaks. And for a grade 3 for flexor carpi ulnaris, the patient breaks at immediate resistance. Now let's put both of those muscles together for grades 2, 1, and 0. I'll have my patient's wrist on a towel, bringing them into a candlestick position. I will have them go through available range of motion, asking them to bring their hand towards their chest and face. And that would be for a grade 2. For grade 1, I would palpate both flexor radialis, carpi radialis, and flexor carpi ulnaris. Ask the patient to assume the position. And there is no movement but contractile movement at the muscle. For 0, I would ask my patient to move, contract for the muscles, and there is no discernible motion. For wrist extension, just as we saw in wrist flexion, there are muscles that we can isolate for grades 5, 4, and 3. On the radial side, we have extensor carpi radialis longus and brevis. And on the ulnar side, we have extensor carpi ulnaris. I'm going to ask my patient to be in a pronated position, putting them through available range of motion, asking them to bring their fingers up towards their elbow, asking them to hold the position. I will apply pressure on the radial side, stabilizing at the ulnar side, using 2 fingers at the base of the 1st and 2nd metacarpal, and asking my patient to bring their fingers towards their elbow. I will apply pressure down in a flexion position, asking them to hold it, hold it, hold it, hold it, and that would be a grade 5. Grade 4, the patient breaks after being able to hold it, and a grade 3, the patient breaks immediately with resistance. Let's go over to extensor carpi ulnaris before we move on to grades 2, 1, and 0. I would use my right hand to stabilize on the radial side, asking my patient to go into extension, I would apply pressure on the base of the of the fifth and fourth metacarpal in a flexion downward position, asking them to resist my motion, bring their fingers towards the elbow. I'll ask them to hold it, hold it, hold it for a grade 5. Again, with the other side, a grade 4, the patient would be able to hold it and then break. And then for grade 3, the patient would break immediate with resistance. Let's go on to combine both sides of the wrist in an extension position. So for extension, my patient has a towel underneath them, and they're going to bring their fingers in an extension position backwards. Okay, so that would be a grade 2. The patient is in a gravity minimized position and available range of motion with wrist extension. For wrist flexion for wrist extension grade 1, I would palpate on the radial side for longus and brevis, and on the medial side for extensor carpi ulnaris. And there would be no motion when I ask my patient to move, but I do feel contractions of the muscles. And in a grade 0, there would be no discernible motion when asked to perform the wrist extension. Thank you.